Okay, so I'm going to go ahead and perform a head-to-toe assessment on you. Basically, I'm just going to look at your body, anything abnormal. I'm going to be able to see and chart it, and that way I can let the doctor know. And do you have any questions?
No.
Okay, so let's see. I'm going to go ahead and provide patient safety. So my patient's on the bed on the lowest setting. Bed is locked. I'm going to go ahead and provide patient privacy. So the door is closed. If there wasn't a door, I'd use a curtain. I'm going to go ahead and evaluate her gait. So I'm going to have her stand up if she can. Okay, and then I'm going to have her turn around, maybe walk a few steps up and back. Okay. And while I'm doing that, I'm going to look at her spine, see if everything looks in line. I'm going to have her lift up her shirt and everything looks in line. Okay, thank you so much. You can go ahead and lay back down for me. Okay, so I'm going to go ahead and evaluate her hygiene. She looks very clean. I don't notice any odors. I don't notice anything abnormal, as if she's not taking properly care of herself, or if she was a homebound patient or a nursing home, if she's getting properly cared. But she looks very clean and hygienic. How tall are you and how much do you weigh?
I'm 5'5" and weigh 200.
Okay, so she's 5'5", she's 200. Her BMI would be 33.3, which is obese, but not morbidly obese, and there's room for changes, dietary and stuff like that we can go over at a later time if she wishes so, or if the doctor wants me to. I'm going to go ahead and check her vitals. So I'm going to go ahead and put a blood pressure cuff on her, put my pulse ox, check her temperature. So her blood pressure is a normal range of 120 over 80, and her pulse is 80, and her her oxygen is 99% on room air, and her temperature is 98.8, which is normal ranges. If it was abnormal, let's say if she's hypotensive, like 93 over 63, I would recheck it on both arms. Or if she was hypertension, such as like 280 over 160, I would go ahead and check on both arms and do a manual. But her vitals are stable in normal ranges. I would go ahead and evaluate her level of consciousness. So if you can tell me what your name is, and you did, where are we at?
We're at the hospital.
What city?
Beeville.
And what are we doing here today?
You're checking me out.
Okay, and what time and date is it?
Right now it is 4:30 in the morning, and it's November 28th.
Okay. So she is orientated ×4, and her glass coma scale. So she has spontaneous eye movement. She's verbally orientated, and she obeys motor commands. So her glass scale is 15. So if you can do me, go ahead and wrinkle your forehead like this. Okay, she wrinkles her forehead. If you can smile and puff out your cheeks. All right. And I'm going to go ahead and have you shrug your shoulders against me. Okay, so her cranial nerves 7 and 11 are intact. So I'm going to go ahead and look at her skin, her integrity. It looks moist. She has a good skin turgor. Moist, warm, no lesions or markings or lacerations that I've noticed. I'm going to go ahead and check her head and her face for symmetrical. So I'm going to take off her mask. Okay, so everything looks symmetrical. I'm going to go ahead and look at her scalp. No lesions, no tenderness to the scalp area. I'm going to go ahead and look at her eyes. So I'm going to look at my pin line, do my pearl, which is pupils equal, brown, and reactive. So I'm going to go ahead and look at my pin light. Just going to look at it. Okay, so I'm going to look. If you can follow my pin. Okay, and if you can tell me when you start seeing my pin.
Right there.
Okay.
Right there.
All right, perfect. So her pupils are equal, round, and reactive, and light a combination. So her cranial nerves 3, 4, and 6 are intact. So I'm going to go ahead now and look at her ears and note the symmetry, if there's any drainage at all. I'm going to use my pin light and look inside. Okay, I don't see anything on this side and on the right. Okay, no discharge. I'm gonna go ahead and do the whisper test. 4K2. If you can repeat that to me.
4K2.
Okay, perfect. 4K2.
4K2.
Oh, perfect. So the whisper test is intact. Her tengus and pinna, no tenderness or pain when I palpated. So her cranial nerves 8 are intact. I'm gonna go ahead and inspect her nares. Okay, with my pin light. They are painted, no drainage. I'm gonna go ahead and look in her mouth. Look at her teeth, her tongue. You can lift up your tongue for me. Perfect. So her mouth, her mucus, her gums, teeth, and throat, lips, and her uvula. Can you open your tongue? Perfect. So her uvula does rise and fall. So her cranial nerves 9, 10, and 12 are intact. So I'm gonna go ahead and palpate her. You have to leave it off. Sorry. I'm gonna go ahead and palpate her lymph nodes. So her posterior ocular, her preocular, her occipital, her superficial cervical, her deep cervical, her posterior cervical, her supraclavicle, okay, and her, let's see, paranoida, P-A-R-O-T-I-D, can't say it. Tonsillar, and her submandibular. So all her lymph nodes are normal. No, there's no extra fat or anything that I've known, not fat, but mass in them. So I'm gonna go ahead and check her range of motion of her head. So if you can do a rotation, so you're gonna go like this, perfect. And extension, so you're gonna go backwards, perfect. And flexion is forward, perfect. And if you can go, I'm gonna palpate her thyroid, if you could swallow. Okay, so a patient is able to swallow and have all range of motions of her head and neck, her neck, I'm sorry. So I'm gonna go ahead, and since this is a female, I'm gonna go ahead and just verbalize. I'm gonna look at her breast for her shape, and symmetrically there's no lesions. I palpated to see if she has any nodules that would indicate any breast cancer. So I'm gonna go ahead and palpate that, and any tenderness, and she does not have any lesions or nodules on her breast area. So I'm gonna go ahead now and inspect her chest for respiratory, her thorax, and her anterior posterior transverse ratio is a normal limit, so 1 to 2. So I'm gonna go ahead and palpate the. Oh, okay, back. I'm gonna have it. Oh, you sit up. Okay. Okay, so I'm gonna go ahead and have my patient sit up and palpate for the 10 signs, or her 10 spots. So here, 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 here. And then I'm gonna go ahead and precuss. So I'm gonna use my finger, precuss. Oh, sorry. Okay, and then I'm gonna auscultate. I'm gonna go ahead and listen to the 10 spots. Okay, so that was my anterior side, so I'm gonna listen to the lateral side, this one side over here, one side over here, and then in the back, 10 sides. Oh, I'm sorry, right here. And then as I'm doing that, have my patient breathe in and out. Okay, so I'm also going to inspect the jugular, for any distension. There's no distension. Okay, you can go ahead and lay back for me. If you want, you can put your mask on. If you feel. Okay, so I'm gonna go ahead and now listen to her lung sounds. I'm sorry, her heart sounds. So I'm gonna go ahead and listen to the aortic, the pulmonic, the Edwards point, the tricuspid and the motor area. So right here in the middle, down, down. So it's left to the right, to the left, top, middle, down, and the matrix area, which is, I'm going to listen for my, oh, I need to actually put it in my earlobe, sorry. I'm going to go ahead and listen for a full minute for my apical pulse. So, and it's the middle clavicular line and the fifth intercostal space for the mitral area valve. Okay, so now I'm going to look at the abdominal area, and I'm going to go ahead and inspect the abdominal area, look at the stomach, of the size, the shape, any abnormalities, as if like she has any mass to one side compared to the other. If it's all symmetrical, everything is symmetrical. Then I'm going to go ahead and pre-cuss. So I look first, then I'm going to auscultate. So I'm going to go ahead and listen with my stethoscope to the right lower quadrant, right upper quadrant, left upper quadrant, right lower quadrant. And then I'm going to go ahead and pre-cuss. So I'm going to go ahead and listen for any sounds. So when I look at the right lower abdominal area, I'm going to be listening for the appendix or the small intestine. When I go to the right upper quadrant, I want to listen for any abnormalities when I pre-cuss for the liver or the colon or the pancreas. When I do the left upper quadrant, I'm going to be listening to the liver or the spleen or the stomach area. Left lower quadrant, I'm going to listen to the small intestine, colon, or the ureters. And then I want to go ahead and pre-cuss in the middle, the medial line, which is going to be where the small bladder is at. So, and also before I even pre-cuss my patient, I'm going to ask her if she's in any pain. So if she complained of right lower pain, I would do that area last. And that way it doesn't affect when I pre-cusp any area. So then I would do my light palpation. So when I do my light palpation, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So no abdominal pain at this time. I didn't notice any abnormalities when I pre-cusp or palpate or auscultated. And I heard all active quadrants. And if I didn't hear any, if it was not active, I would listen for a full minute in that one section. 5 minutes. So if she didn't have any active bowel sounds in the left lower quadrant, I would listen for a full 5 minutes before I continued to ensure that I did not hear any active bowel sounds. So once I did the abdominal area, I want to look at her musculoskeletal. So I'm going to go ahead and inspect and palpate her arm. I'm going to have her flex her arm. Okay, so I'm gonna extension, so you're gonna pull back, and then flexion, perfect. And then same thing with your legs. Oh, sorry. Okay, perfect. So she has all range of motions to both bilateral lower and upper extremities. She has good capillary refills on both her fingers and her toes. I had my patient remove her socks so that way I can look at her toes as well for capillary reflexes. I also look for any edema signs in her lower legs, no edema. Let's see. So I already looked at the spinal column when she was standing. I looked at nail bed, symmetrical. So the next thing I would do is I'll palpate her carotid to check for pulse. So I would go ahead and have my stethoscope and listen as well and palpate. So I would listen for a full minute. Then I would do her brachial and her radial, her femoral, her pectoral, patella, and her dorsus pedis. And she did score a 4, which is strong, bounding pulse. on that. So I did my head to toe assessment, so I have 25 minutes to document everything. I would document her, I would document her from her head down to her toes. So everything was within normal limits. She had good reflexes, had good capillary refills. Her abdominal area was able to listen without any problems, palpate. I was able to listen to her chest, her heart sounds, her lungs sound good. Overall, very healthy patient. Okay, thank you.